My name is Dr. Mark Gaon. I'm a plastic and reconstructive surgeon. I work with a group called Breastlink. We do all the reconstructive surgery after breast cancer care for that group. I also work with an entity called Finesse Plastic Surgery. We do all manner of reconstructive plastic surgery as well as cosmetic. My training is from New Orleans, Louisiana. I went to Tulane for medical school, and then I did residencies in general surgery, trauma, and critical care at Cedars-Sinai in Los Angeles. And then I finished my plastic surgery training at the Methodist Hospital in Houston. So after a complete mastectomy, we have several options of reconstruction. Mainly, they fall into two arms, using either an implant-based reconstruction or tissue-based, or even a hybrid. So the vast majority of reconstructions now are done in stages. The first stage is actually to place a deflated tissue expander underneath the muscle beneath the skin of the resected breast. This starts out very flat and deflated, but it's a very firm outer shell of silicone that has an integrated port. Through this port, we do fills after the surgery, and we keep expanding it to rebuild the breast. Once that's in place and stretches the breast to appropriate dimensions, then we swap that out for a permanent implant. And the different types of implants we have are a saline implant that's a silicone shell filled with salt water. Then we have silicone gel implants, which are silicone shell filled with a jelly type of silicone, very soft and natural feeling. And then the newest implants to market are actually called gummy bear implants. They're cohesive gel. If you can see, they have a shape to them, so they're shaped like the anatomic breast, and they more closely mimic the shape of the tissue that's removed after a mastectomy. So with these new implants and the newer devices and techniques, we can get a very, very nice cosmetic result for an otherwise quite deforming surgery after mastectomy. The other type of surgeries involve tissue transfer from other parts of the body into the breast, mainly from the abdomen or the stomach, from the back, from the inner thigh, from the buttocks. And typically those are reserved for more complicated cases where the patient has to undergo additional therapy after mastectomy, such as radiation.